wounded farmer stumbles into a temple in Thebes, blood dripping from a gash on his arm. Instead of rushing for bandages, the priest-physician prepares a paste of honey, animal fat, and crocodile dung. The mixture is smeared into the wound, while a spell is whispered to banish the demon of disease. This isn't fantasy. This is recorded history. In 1873, the German Egyptologist Georg Ebers purchased a papyrus nearly 20 meters long, dating back to 1550 BC. Inside were hundreds of remedies. Some were astonishingly effective: aloe for stomach ailments, garlic for infections, honey for wounds. But others were utterly bizarre, even dangerous: raw meat on swelling, lizard blood as medicine, and spells to chase invisible spirits. This is the paradox of Egyptian medicine. These healers could diagnose fractures, stitch wounds, and even construct prosthetic limbs, but they also called upon gods and curses to heal. What you're about to discover comes from temple archives, ancient papyri, and archaeological evidence that expose just how far Egyptian doctors blurred the line between science and sorcery. In Egypt, healing wasn't just a craft, it was divine. The physician was not only a healer, but a mediator between humans and the gods. The chief deity of medicine was Imhotep, a real man who lived in the 27th century BC and later became deified. To Egyptians, he embodied the fusion of wisdom, architecture, and healing. Patients sought his intercession long after his death. Organized and specialized. Unlike many ancient cultures where healers were generalists, Egyptian doctors were strikingly specialized. Herodotus, the Greek historian writing in the 5th century BC, marveled that each physician treats a single disease and no more. There were physicians of the eyes, of the stomach, of the teeth, clear signs of systemic medical practice. This wasn't guesswork. Archaeologists have found lists of physicians inscribed in tombs. Some worked directly for the pharaoh's court, enjoying high status. Others were attached to temples, where medical and spiritual healing went hand in hand. Medical texts as evidence. The Edwin Smith papyrus, dating to around 1600 BC, is a surgical manual unlike anything in the ancient world. It details 48 cases of trauma, broken jaws, skull fractures, spinal injuries. Each entry follows a formula: description of the injury, diagnosis, prognosis, and treatment. For example, one passage describes a skull fracture. If you examine a man with a gaping wound in his head, penetrating to the bone, you should palpate it. If he shudders greatly, and his 2 eyes are veiled with blood, it is a condition not to be treated. This was clinical reasoning thousands of years before Hippocrates. Egyptian doctors could differentiate between treatable injuries and those beyond help. They stitched wounds with linen, immobilized fractures with splints, and used honey as an antiseptic. Skeletons and mummies tell the same story. Remains show healed fractures, amputations that suggest surgical skill, and even prosthetic toes, crafted from wood and leather, worn smooth by use. These weren't symbolic objects, they were medical devices designed to restore function. Egyptian medicine was therefore a paradox, both astonishingly rational and deeply bound to spiritual belief. And it is to those strange beliefs that we now turn. The Ebers papyrus contains over 800 prescriptions. Some are ingenious. Asthma, herbs heated on a brick, the patient inhaling the fumes. Contraception, honey mixed with acacia and dates, substances that modern science confirm have spermicidal properties. Digestive issues, garlic and onions, rich in antimicrobial compounds. But then there are the grotesque: hair loss,
crocodile fat, hippopotamus fat, and porcupine hair mixed into a scalp ointment. Toothache, mouse dung paste. Fertility spells, women instructed to insert mixtures of crocodile dung to prevent pregnancy. The line between brilliance and absurdity was razor thin, and sometimes the absurd had unintended effectiveness. Moldy bread, prescribed for infections, might have introduced early penicillin-like effects. Honey, often applied to wounds, is still used today as a natural antiseptic. Disease as demonic. But Egyptian medicine went beyond herbs and poultices. Illness was often thought to be the work of hostile forces, spirits, curses, or the wrath of gods like Sekhmet. The cure was therefore twofold: physical treatment and spiritual defense. Incantations litter the medical papyri. A wound dressing might include words such as, "I drive out the one who comes in darkness, the one who comes unseen, who enters the body and destroys." Doctors weren't just healers, they were sorcerers. To treat illness meant to restore ma'at, the balance of the universe, by casting out chaos. The role of Sekhmet. Priest-physicians devoted to Sekhmet were particularly feared. Sekhmet, the lion-headed goddess of war, could unleash plagues upon Egypt. Her priests claimed the power to both summon and banish disease. Some rituals involved offerings and bloodletting to appease her wrath. In a sense, Egyptian doctors weaponized fear. Healing wasn't just about herbs, it was about divine control. Why the blend? Why this strange fusion of science and superstition? The answer lies in Egyptian worldview. To them, the body was inseparable from the cosmos. Sickness was not merely biological, it was spiritual imbalance, divine punishment, or demonic intrusion. A cure had to treat both body and soul, or risk failing altogether. Egyptian medical knowledge spread far beyond the Nile. The Greeks borrowed heavily, with Hippocrates and later Galen citing Egyptian practices. The Romans, too, employed Egyptian physicians in their armies and courts. Even surgical instruments discovered in Roman sites echo designs first seen in Egypt. But Egypt left behind two legacies, one of rational medicine and one of superstition. The idea that certain herbs and treatments could cure disease endured, influencing modern pharmacology. Yet the magical thinking also lingered. For centuries, medicine across Europe and the Middle East remained intertwined with astrology, charms, and incantations. For Egyptians themselves, the consequences were mixed. Some benefited greatly from advanced wound care and herbal remedies. Others suffered. Imagine an infection worsened by dung applied to a wound, or infertility treated with animal fat mixtures that had no effect. For many, the line between healing and harm was thin. What is perhaps most haunting is how modern this paradox feels. Even today, in the age of antibiotics and advanced surgery, people turn to miracle cures, home remedies, and spiritual healers. The Egyptian doctors remind us that medicine has always been a battleground between knowledge and belief, between the seen and the unseen. Egyptian medicine was not a primitive superstition, nor was it modern science. It was both. Doctors in Egypt could diagnose fractures with precision, stitch wounds, and prescribe surprisingly effective herbal remedies. But they also relied on crocodile dung, lizard blood, and incantations to expel demons. This strange duality tells us something profound about Egyptian civilization. They lived in a world where order and chaos were constantly at war. Healing was not just about the body, it was about restoring cosmic balance. Today, the sanitized versions of history remember Egypt for its pyramids and pharaohs. But hidden in their medical texts lies another truth, a civilization where doctors wielded both scalpel and spell, and where the line between cure and curse was almost impossible to see.
Egyptian medicine straddled two worlds, science and sorcery. Do you think their reliance on curses and spells made them less advanced, or do you think it shows a deeper understanding of the human need for both physical and spiritual healing? If you want to uncover more of the secrets time forgot, subscribe to History Sleuth and ring the notification bell. The past is full of mysteries, and together we'll investigate them all.